My name is Ruby from the RubyGarmaNetwork.com. Today we have a special guest all the way from Las Vegas, Nevada. No other than my dear sister, Marissa Garma Agodon. She's here with us to share her journey in working in the healthcare industry as a customer service rep, claims, and billing for many, many years. So, my sister, Marissa Garma Agodon, um, is here, and I would like her to introduce herself. Go ahead and introduce yourself, Marissa.
Hi everyone. My name is Marissa Garma Agodon, and yes, I work in the healthcare industry as a medical biller for many years, at least 20 years in billing, and then a year ago I started working in the insurance industry, being a customer service health advocate for employers and individual.
Okay. So, this healthcare industry that you work for right now is health insurance, isn't it?
Yes.
Okay. And what is your job duties where you work now?
My job duties are customer service. Like I said, we answer calls for the employee and employers, members that are calling regarding their claims, educating them on their benefit plans, asking about their authorizations, and if there's any claims that need to be reprocessed, we process those claims, and also advocate members and educate them on their deductibles and explaining the plans that they selected, because sometimes they don't understand what they selected and they would get upset when they get a payment from the provider. So we had to explain as best as we can to help them and educate them to know their plans.
Okay. When you started at your new job as a customer service representative, how long was the training?
We had a training of 6 months. It's like a 4 year college, but they group each section into short period of time and made it into a 6 months process.
Okay. So that's like an 8 hours a day, Monday to Friday?
Yes, Monday to Friday.
Okay. So they started you by introducing what the company is all about and slowly break it down to the day to day business when you do the customer service.
Yes.
Okay. How was that training?
The training was pretty intense because it was 6 in the morning to 2:30. Um, it was remotely training at home. So
Okay.
the trainer would just explain things like for example, the the system and how we would navigate the system, how to look up providers, how to look at the benefits, where to look for the claims, why it was denied, and things like that. It was just broken down in each section. It was just a lot to take in for on a daily basis because we learned so many different aspects in the medical that I have not learned when I was in billing.
Okay. So the customer service itself, what is the priority? For every call, do you have to resolve the issue right there and then?
Yes, we have to make sure the call is. We have to be the hero for the member. We have to make sure that when a member calls, we ask their name, date of birth, and why they're calling and how can I help you. We also have to bond with the member as well.
Mm-hmm.
To say, hey, how can I help you today? Or how are you doing today? Before we get into the issue of the caller, so that way we can connect with the member before getting into why are you calling? How can I help you today? Things like that. And then we also have to fair praise and end the call
Mm-hmm.
and explain what they called about and say, hey, you called about your claim today. Thanks for calling. And then we have to share about the app, the site that they can view it at, the company site, everything that we talked about.
Mm-hmm.
And then we have to ask if we resolved the call
Oh, okay.
because it will survey, and the survey is what makes your matrix to how well you did on the call.
Okay. So for every call that you answer, is there a code that you need to enter? What they're calling about?
And we
Or
just ask for the member ID,
mhm. The
and
member
then
ID, is that the identifier just to verify if they're the right member? And you,
yes, and then if that is the right member, then we ask if they're calling for themselves or a member in the family.
mhm. The if someone representing the member, how do you take care of that call? Do
If
they have
the
to have,
mom,
yes, for example, if it's the mom calling for a daughter or a son, how would you handle that?
well, I have to look at the age. I have to ask for the name and date of birth.
Okay.
If they're over 18 and they're still covered under the plan, um, I'm not allowed to disclose certain information to the mom unless they have a HIPAA verification on file
Mm-hmm.
that they are able to. I can only disclose general information. You
Okay.
know,
But they have to have a consent on file in calling regarding that member, correct?
yes, to give all the other information, like the sensitive information, yes. But if they don't, I can only give general information.
Oh, okay. If the member is has a consent for the mother to call, does that consent have a specific expiration date?
No, not necessarily, as long as it's in the system.
Okay. Then it says no expiration, right?
Yes.
Okay, because sometimes for any family, for example, if I'm giving my son to be able to call in regarding my issues, then I have to put a limit how long that consent can be and what area they can only call for. Correct?
Yeah, you can do that too.
Oh.
We can provide general information. We
Mm-hmm.
can't give all the sensitive information, like the what was for the
Okay.
diagnosis, anything that like what provider it was and why you came in for,
Mm-hmm.
what it was for. We can't disclose any of those sensitive information.
Oh, okay. So part of the compliance and regulations that you have to follow is the HIPAA regulations, correct?
Yes, the Health Insurance Portability Accountability Act
Oh,
to protect members' information.
mm-hmm. And how often does the company train you for that?
We train once a year. We have a learn source
Mm-hmm.
that we have to watch a video and read some documents on there for new regulations that are new within the company, and then you take a test and you have to pass at least 80% in
Okay.
order to move to pass. Otherwise, you have to redo the whole thing again till you pass.
Okay. Oh, good. Good. I like that because everybody else should be informed and knowledgeable about the HIPAA. Okay, let's go to the next question. You did billing before, correct?
Yes, I did.
And tell us how that experience.
Well, I started billing when I lived in Hawaii. I actually started in a radiology group. I started in the file room actually. Then I went to the front desk, and my supervisor saw that I had growth in me, so I she put me into billing, and I took classes for customer service at a hospital there in Honolulu, Hawaii,
Mm-hmm.
and I also took terminology class, and then just did billing there. I didn't really go to school for it, just by experience.
Okay.
And then when I moved to Las Vegas, I worked at a internal medicine. Then I went to a physical therapy, another radiology group, a hospital, and now I'm in the insurance industry.
Okay, that's a very good experience. So, working in the healthcare industry, what do you think is the best experience for you that you can remember?
Well, the best experience is moving into the insurance company. I felt like um, I felt like everything that I learned in billing from working in a different specialty and different providers, moving into a bigger corporation like where I work now, um, the best experience, it's actually the best experience I've had so far, because not only because they're big, they allowed you to work at home,
Okay.
and the leadership are better.
Okay.
Um, they actually listen to you, and the benefits are better. It's just, and then you learn more. They educate us.
All right.
They give us training. They give us a lot of to learn our job, and then you can move up.
Yeah, it's easy to go around the company or to move up,
Yes,
not go around, but move up within the company. Okay.
yes, and
That's a very good experience. I believe in keep on moving on and getting skilled in other areas of the healthcare industry. But since we talk about your best experience, do you remember the worst experience that you have working for the healthcare?
oh yes, I worked for a company for 14 years. I love the people that I met.
Mm-hmm.
Um, I I work hard and I learn a lot there. But however, I had a really bad experience with a manager. I was not happy.
Mm-hmm.
Um, but I went to work every day because I had to earn money to support myself and my family, medical and all that. But it was hard to go in every day. But I maintained it for 14 years until I opened my eyes to say, hey, it's time to go.
Yes.
Because if they don't appreciate your hard work and they don't care about you or listen to how to make your job better,
Yes.
it's time to and experience other places. And that's why I say the company I'm in now is the best experience I had, because not only they have great leadership and training, they also train you to become a great supervisor as well, or if you ever want to be in that field,
Mm-hmm.
and educate you in any area of where you want to be.
Yep. That's good. Yes, if a company or anybody that doesn't value your worth, I think it's time to go and open up a new beginning for you. So you did a good job, sis. Were you part of making sure the company that you work for is in compliance with the regulations? So, what I meant is, other than the HIPAA, is there anything else that you guys need to comply with? Do you remember?
Yes, yes, we have to learn. We have to comply with the rules as well as for fraud
Mm-hmm.
investigation, and um, we have to make sure our monitors are locked when we leave our desks.
Okay.
Even if you work at home, you have to make sure everything is secured, especially when you we don't fax anything, but anything that we email to the members, or any email we get, we make sure we um, report to IT,
Mm-hmm.
and anything that can get access to our computer. Yeah, we have to monitor all those as well.
Oh, okay. And then your password, right? You can only keep it for so long and then you have to change it.
Yes, we have to change it every 3 months, but
Mm-hmm.
now I think is changing it to 12 digit now, so that way it doesn't change
Okay.
anymore. I think that's the new policy. It changes every so often, but I don't know how long that will take before they change that again.
Okay. Oh, good. Yeah, there's a lot of training as well as other areas, and even for us, we have a lot of security training. So how do they prepare everyone at the company that you work for so that they can be compliant with the regulations? So how often is the training?
We have learn source, the different learn source for each category, whether it's fraud and abuse or security for the system, and we have training for like different passwords and anything security with the system itself, not only the internet, but the protecting our members regarding the system that we have the main file in
Mm-hmm.
for our medical information. We also have training on how to for HIPAA. Like I said earlier, we have the HIPAA training.
Mm-hmm.
We have to test. So once a year we do those, but it comes randomly, different classes for each one. Like we have fraud and abuse next week, and then
Mm-hmm.
we have next month. I have a learn source for provider lookup, and then we have coming up open enrollment. Those are the things, and then we also have our password resets and IT information, disclosing all these things for email, faxes, and all that. We have training throughout the whole year at different months.
Oh, okay. Oh, that's good. At least in that area, it's well planned for you guys to comply, because otherwise, they don't want the company to be not compliant. So,
Yeah.
says any future plans to go back to school?
But I've been thinking about going back to school, but mainly to improve what I'm doing now to so that I can move up and do more with the company.
Mm-hmm.
Probably, I've always thought about it, just haven't actually made a move
Okay.
to get my certification in coding and maybe auditing.
Yes. I think that's a good area, or with your experience now, You can also look into project specialists or project management because they need a lot of that also in the healthcare industry. Okay, what can you tell our audience if they're searching for a job in the healthcare industry? What advice can you give them?
Well, there's a lot of jobs out there. That besides healthcare, there's many like hospitality, IT, um, restaurants. But being in the healthcare industry, there's always a job. There's not even if you're not a nurse or a doctor or physical therapy or pharmacy. There's jobs in the office like front desk, file room. There's even couriers. There is always a job in the industry. So if you're interested in becoming um, or wanting to apply for the medical, just go out there and apply. Some of those jobs don't even require education because, like I said, I didn't go to school. I got in because I applied and they hired me from the beginning, from file room to front desk to becoming a billing. And that's where I started. You can do it too. And like I said, when we got hit in 2020, where the economy, we got this COVID, healthcare was still open. And anyone working in the office, they sent us home and we were always open. And the rest of the other people lost their job. So it's
Yes.
always good to work in the healthcare because there's always jobs for you in the healthcare industry.
Yes, that's right. I do agree, or I cannot agree more to what you just have mentioned. Healthcare industry is there to stay. People get sick. The doctor gets sick. The nurses get sick. Everybody gets sick. So there's always the healthcare industry looking for someone like you to work and serve the community or the members. Okay, thank you, sister, for giving your or sharing your experience and journey in working for the healthcare industry. And maybe for next time, we can interview you again. So thank you so much.
Oh, you're welcome. Anytime.
Thank you. If you like this video and you want to see more content, please comment, like, and subscribe, and see you in the next video.